Hey guys, my name's Cam and I'm a student physical therapist here at Campbell University. Today I'm going to be showing you a manual therapy technique for pelvic upslip dysfunction. This technique is called long axis distraction manipulation. So we're going to be using this technique for patients that you've gone through the evaluation and assessment and you found that they have an upslip at their SI joint, and they're going to have associated pain with this upslip. So an upslip can occur through a number of different means, whether that be they fall, car crash with their legs extended. Sometimes this can happen with people that land after skydiving, forceful impact on a extended leg. It's even been found with pregnant people. There can be some laxity in some of the ligaments that can, especially the SI joint, that can cause an upslip. So these are all patients that could potentially benefit from this manipulation to help decrease their pain. So to perform this technique, it's going to be very important to have good patient positioning and good therapist positioning. So for patient positioning, we're going to want to have them in a prone position on the table. And for PT positioning, we're going to want to have good body mechanics. So we're going to want to have the table at an appropriate height, right around waist height. And to make sure that when we're doing this manipulation, we don't want to provide too much force at the knee or the hip. We don't want to be distracting them. We want to provide all of our force at the actual SI joint. So in order to do that, we need to be able to put the hip into closed pack position. So for a closed pack position, that's going to be extension at the hip, abduction at the hip, and internal rotation at the hip. And that's going to put the hip in a closed pack position, so we're applying all of our force directly to the SI joint. Okay, so I'm going to perform the manipulation now, and I'm just going to run you through it. So first thing we're going to do is we're going to grasp the lower extremity just above the malleoli with both our hands. Then we're going to get into a nice athletic stance, just so we have a nice base of support for ourselves. We're going to get the hip into that closed back position, so abduction, internal rotation, and extension. And then we just provide a nice lean back to get to our end range. And this is a high velocity, low amplitude movement. So when we get to that end range, we're going to have the patient take a deep breath in and a deep breath out. And then when they're taking their deep breath out, we're just going to provide a quick movement, and that will provide our forces through the SI joint. Perform this manipulation as if Adriana here, she's my assistant at Phys, she was really a patient. So we're going to talk through it and perform it as if she was a patient. So we finished your assessment, we went through your objective and your evaluation, and we found that your SI joint, your hip, was actually a little bit higher on your right side. And we think that this might be the source of your pain. So I'm going to try a manual therapy technique that can help with that, help decrease your pain and get your hip and your pelvis into their alignment. So what I need you to do is, if you can lay on your stomach for me. And if you need to, you can grab onto the sides of the table. So I'm going to be pulling on your leg a little bit. It's not going to be painful. If it is, let me know. I'm going to provide just a quick pull, and that will help get your pelvis into better alignment and hopefully decrease your pain. So I'm just going to grab on here, lean back a little bit, and you should feel some pressure here. And then I'm just going to want you to take a deep breath in and out. And that's it.